My name is Dr. Gerard Pregenzer, and I practice in the greater Hartford area of Connecticut. I was born in New Jersey, and I went to medical school at New Jersey Medical School in Newark, New Jersey. And then I did my residency in urology at the University of Connecticut. Why not? It's the best field you could go into. One of my professors when I was in medical school told me that I had the choice. I could either choose to go into urology or I could waste my life. So I decided to go into urology. Honestly, it's a very, very fun field. It helps me to really connect with my patients on a very personal level, and it really helps me to improve their quality of life in some very, very personal and sometimes awkward to talk about areas. Things like erectile dysfunction, bladder dysfunction, a lot of problems that people otherwise might not get help with. I actually have the opportunity to help them, and that means a lot to me. I really like the quality of life areas of urology. So in particular, things like erectile dysfunction, bladder dysfunction. In particular, I find that erectile dysfunction is really satisfying for me because it's a very, very underserved diagnosis. Men don't come in and talk about it frequently. In fact, most of the patients in my practice that I help with their erectile dysfunction have come in for something else. And I always make a point, I don't care how old a man is, I ask him about his erectile function. And if he's of a certain age and he tells me it's great, I ask him again and I say, are you sure it's great? And I've had a lot of really interesting interactions where a man will say, well, I'm however old I am, 60, 70, 80. I'm not supposed to have erections anymore. I say, I'm not sure that's really true. And the question is, do you want to? And if the answer is yes, then I'm more than happy to help them with that. I like to focus on men's health because very frequently men don't seek help with health issues, especially very personal issues like erectile dysfunction. And I've seen men's lives changed just by offering them assistance in an area where they didn't think they could have help. I've seen marriages saved. I've seen men sort of come back to who they were just on an emotional level. And that is exceptionally gratifying for me and my practice. I want you to know you can talk to me about anything. If you have a concern, about your health, about your erectile function, there's nothing that's off the table here. Talk to me about everything. And I especially want to hear about the things that you might not be comfortable talking to other physicians about, because I'm here to help, and I really want to.